Okay, Nick, we'll check back. Thank you very much. Richmond and Henrico health leaders are tackling three major concerns today: COVID-19, the baby formula shortage, as well as gun violence. Live at 5, Richmond reporter Henry Graff is at the City Health Department downtown with details for us. Fill us in, Henry.
Well, Kurt, we'll start off with some good news locally. That Pfizer booster shot for kids aged 5 to 11, if approved, could be out here on the market in Virginia as early as this weekend. But the bad news, this comes as we are experiencing rising COVID cases now.
Richmond and Henrico's COVID-19 case counts are climbing, potentially moving into new CDC community levels. Richmond could go to medium and Henrico to high.
If we went to a high or an orange level, indoor mask wearing. So going back to wearing masks for a couple of weeks as we're in this next wave, social distancing when possible.
Since the start of the year, health leaders have distributed 30,000 at-home test kits. They're also ramping up public testing events, like this one Wednesday morning at the Eastern Henrico Recreation Center. But the anticipated demand wasn't there.
If you have symptoms, even mild ones, that you're not sure if it's allergies or something else, go ahead and get tested.
The health department also answering the call for new mothers searching for baby formula. There's a particular focus on the 1,000 Richmond parents who are on WIC, a state nutrition program to help lower income families.
The challenges and pain of really trying to figure out where that's coming from is really, really challenging. And every family is going to be in a unique, different situation.
We're also hearing our first words from the city's newly hired gun violence prevention coordinator, tasked with curbing what city council has labeled a public health crisis.
If all of those spaces for young people and their families are toxic, if all of those spaces include, young people living in fight or flight mode, then there's no relief. There's no, how can they focus in those spaces?
Back out here live, Braxton's been on the job for about a month now, so we should expect to hear more from him in the coming future. Back to COVID, CDC expected to update those assessments on the threat level here in the community for COVID sometime later this evening. So we'll have an update on that for you later on. For now, live at 5 here at the City Health Department in downtown Richmond, I'm Henry Graff, NBC 12 News.